Hi, my name is Dr. Berg, a chiropractor of River Vale, New Jersey. I'd like to spend a little bit of time talking about a very common condition that affects a great many of us, and that is headache. I have with me a plastic model of the spine, and what I'd like to share with my community is some basic anatomy, a little bit of anatomy and physiology explaining why headaches can have their derivation from the neck. First of all, in the neck spine, we have something called a vertebral artery that runs up in between all of the vertebrae of the neck. And this is the main artery that brings oxygen and nutrients to feed our brain. Statistics tell us that 95% of headache come about as a result of narrowing of the blood vessels. Yeah. So when we think about this anatomically, what can cause that? Well, first of all, the proverbial word of stress. Most of us who feel very, very tight, we will feel a great deal of muscle tension. Where? They say that human beings carry most of our tension between our neck and shoulders. So as a result of that evaluation, we look at the individual vertebrae to see where there might be some what we call subluxation. Vertebrae out of alignment. Now you may ask, well, how does that happen? Well, I don't know the new patient, but I do know that all of us have had falls, accidents, traumas, a host of different events that can cause the vertebrae to misalign and thus irritate the very tender and gentle nerves that exit, and they are the things that predispose our muscles to stay so very, very tight. Many of us, again, with tension factors, our muscles are always under tension. You may hear someone say, hey Stephanie, just relax your shoulders. It looks like they're coming up under your ears. So these are what we call biomechanical reasons. Now look, I understand headaches can come about from lots of different reasons. People can have brain tumors. People can have digestive disturbances, which, believe it or not, can contribute to headaches. But for right now, we want to talk about the vast majority and how the first line approach is to look at structure as a causative factor. And I will preface this, when we sit with a new patient, it's very important to take a good history, because the history can also direct us to understand whether or not the headache is from a trauma to the neck, or whether it's from horrific eating habits. So that's a component that must be understood. But for right now, and just as a summary, please understand that vertebrae are freely movable. Although we think of the spine as just a concrete block, it is not. And it is these subtle movements in the spine that can trigger nerve root pressure. Correct the nerve root pressure, and for so many people, you've corrected the cause. Thank you.